Welcome everyone to IsisParenting's breastfeeding webinar and chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board-certified lactation consultant, and board-certified in pediatrics. I'm here outside of Boston, Massachusetts at IsisParenting's home office. And with me today in the moderation role is Hillary. So thank you, Hillary, for moderating the chit chat room. And as many of you know, we have 4 centers in the greater Boston area, and this spring we are opening 5 centers in the Dallas-Fort Worth area and 4 more centers in Atlanta, Georgia. So I hope that we'll be coming soon to a city near you. Today we are going to talk about a breastfeeding and pumping topic that many people have concerns about. In fact, milk production, low milk supply is one of the most common reasons people give for quitting breastfeeding. And what I want to focus on initially is the difference between true low milk production and perceived low milk production, and how sometimes what's going on in the very earliest days can have an impact on overall milk production. So to get started, let's just begin thinking about the earliest days of life when a baby is new and milk should be coming in. So typically, if you had a vaginal birth and you're a first-time mom, milk typically comes in around day 3, 4, or 5. If you have a C-section as a first-time mom, it's often one day later. So it may be day 4, 5, or even 6 that milk fully comes in. And as a second-time mom, usually milk comes in about a day sooner. So that may be day 2 to day 3 for a vaginal birth, or day 3 to day 4 for a cesarean. But when I see a mom whose baby is about a week to 2 weeks old, pretty much my questions are, is your baby peeing, pooping, and are your nipples reasonably comfortable in between feedings? The gaining weight part I'll talk about because, as I'm sure many of you know, babies do lose weight before they gain weight, and very often we don't actually track the lowest weight of an infant, which might be day 3 or day 4. So it might be the day after their discharge. That actually may be the lowest, their lowest weight overall. And then last week or the week before, I spoke about artificially inflated birth weights due to large amounts of IV fluid that mom received during labor. So sometimes a baby is born a little bit waterlogged with mom's IV fluid and pees out a lot of that fluid during the first day. So their birth weight may be 7 pounds, 15 ounces, and by day 2, they may actually lose 5% or 8% of their weight, which was just fluid to begin with and not truly weight. So a lot of breastfeeding experts really believe that we should be going by the weight of the baby at the second day to determine what is their baseline weight, their birth weight, as it were. And the reason this is important is because babies do lose weight first, and we really would like them to be back at or beyond their birth weight by 10 days of age. So certainly by 2 weeks. A baby should be at or beyond their birth weight. And if they're not, it doesn't mean that there's a crisis or something devastating going on, as long as they have turned that corner and are now starting to gain more regularly. In terms of what is expected weight gain, the numbers I've put up here are kind of a range of what the lowest acceptable weight gain may be, and then what's on the high end of typical weight gain. So between half an ounce to 1 ounce a day, once they do start gaining weight, which might be around day 6 or day 7, and that equates to about 4 to 8 ounces a week, which is a quarter pound to half a pound a week, which equates to about 1 to 2 pounds a month. So you might think to yourself, okay, my baby is about 6 weeks old, so if they're supposed to be roughly back or beyond their birth weight at about 2 weeks, and now they're a month old, is your baby 1 to 2 pounds over birth weight at 6 weeks? So that would be a good ballpark of where we'd like to see a baby. Breastfed babies in the early days, if you're not complicating the issue with supplementation, the diaper output is a good indicator of what's going in. So you can, in the early weeks, look at the bowel movements and the heaviness of the wet diapers and the volume of poop as a good indicator that the baby is becoming well nourished. So peeing, pooping, and gaining weight are good signs. Once the baby is over 4 to 6 weeks old, you really may not be able to go by bowel movements anymore, because some babies as young as 4 to 6 weeks, and some other babies will wait until 2 to 3 months before they start consolidating their poop. But some babies really do begin to consolidate their poop very quickly and may only have 1 or 2 bowel movements a week. So they may go 3 or 4 or 5 or 6 days between bowel movements. And that is not necessarily a sign of low intake. If the baby is continuing to wet their diapers, if you're seeing 5 or 6 heavy wet diapers every day, if they're disposable diapers, usually you'll see 8. If you're using cloth diapers, people tend to change the diaper more frequently, and the diapers are a little bit lighter because of that. But so you might see 6 to 8 wet cloth diapers or 5 or 6 heavy wet disposable diapers in a 24-hour period, and the baby is juicy and is starting to gain weight well. It's perfectly fine if the baby only has 1 massive blowout a week. The reason I spend some time talking about normal newborn behavior on a webinar that's about milk production and milk supply is because so many women are so shocked by the normal newborn mannerisms that they're sure that it means there's something wrong with their milk, or there's something wrong with their baby, or there's something wrong with the way they're doing things. And the fact that a baby will want to suck constantly, will fall asleep at the breast, will cry and protest when you try to take them off, and certainly will sure as heck not sleep peacefully in a bassinet or a crib for several hours between feedings. A lot of people interpret that to mean that the baby is not satisfied, the baby is not getting enough milk at the breast, and therefore milk supply is low, or the baby should be supplemented. But these things are often interpreted as hunger, and these are all very very normal, that a newborn wants to suck almost constantly, will only sleep when they're held or when they're moving, so using a sling or a carrier or keeping them on the go in the car, in a stroller, can be helpful in terms of helping them sleep. Very normal and common and typical for a baby to fall asleep at the breast, but every time you try to take them off, they'll startle awake and flail. Within 10 or 15 minutes of being put down, they're awake and crying. Cluster feeding, so a lot of babies will enjoy the buffet of the full breasts in the morning and will nurse on and off for an hour or 2 of time in the morning. And then other babies will constantly cluster feed in the evening, nurse and doze at 7 p.m., 8 p.m., 9:45, 10:30, until you can't even imagine that there could be any more milk left in that breast. But there is. Of course, waking often to eat at night. So we have the Hollywood image of a baby who will sleep for 2 hours or 3 hours in between feedings and sleep in that white eyelet bassinet that you so carefully selected, and wake up and watch their mobile for a few minutes and then come to the breast and nurse. And that's not the typical new mom experience at between weeks 4 and to 8, which I think are the hardest weeks in the life of a mom and baby. And on that note, I think it's very helpful to be around other moms who have babies very close in age to yours, because although it does not minimize the challenges and difficulties of that time frame, it certainly can normalize it a little bit. It's very common for new moms to think that their baby is the fussiest baby, the baby that's the gassiest, their baby spits up the most, their baby is irritable, can't be put down. If you feel like you're spending your whole day nursing, holding, walking, bouncing your baby, you're probably right, because between weeks 3 to 8, that's pretty much how babies spend their time. They essentially, I love them dearly, I say this with love, they do 3 things. They eat, they sleep, and they fuss. If they're not eating or sleeping, chances are you're actively involved in keeping them happy. Fortunately, that may not take too much work. It usually involves sucking, maybe milk, and vestibular motion. So if you put them in a sling and walk, if you sit on a physio ball and bounce, if you put them in a stroller and keep them moving, chances are you can lull them to sleep a little bit. But if you think that you can just put them down in their bouncer seat for an hour, forget about it. It's not going to happen. And so when you see and hear other moms talking about similar experiences, or you see another baby projectile vomit across the room, or you hear another mom talk about how she was up 4 times between midnight and 6 a.m., then you might have a little bit more perspective and think, okay, so maybe this isn't something devastating about my own baby. Maybe this is how newborns are. And week 1 of the Great Beginnings New Mothers group, which is our 8-week series for moms and newborns, it's a very well-established program here in the Boston area. We do focus on soothing and settling techniques, and these are the winners right here. So these are the things I've been teaching these for 20 years, and babies really haven't changed that much in 20 years, and these things really help. So vestibular motion, that means a big walk, bounce and sway, or the lazy man's way to do it, which is my favorite, sitting on the physio ball and bouncing. And it's all about getting a little bit of a rhythmic jiggle to the baby's head that triggers a vestibular response in the inner ear, which talks to the brain, which tells the baby to chill the heck out. And it's kind of like you're leaning against the window of a train and letting that rhythmic motion of the train lull you into relaxation. So that's vestibular motion. There are very specific movements for it that work better than others. This is why a physio ball actually works better than a rocking chair if your baby is screaming. A rocking chair is fine if your baby's in a relaxed state, but if your baby is screaming, you're going to need big movements, and there's certain specific movements that work very, very well and very fast. The tummy massage for gas, because let's face it, about 100% of moms would agree that their baby is gassier than the average baby, and if you do the math, you will see that that's not mathematically possible, and yet. So there are very special tummy massages for gas relief, and then compression holds and things like putting the baby tummy down over your forearm, and a variety of other holds and massages that we can show that do help the baby both pass gas, and it does seem to help the baby's digestion. And these are things that you can be doing several times during the day, not just when your baby is red-faced and screaming. Slings and carriers, because babies need to be held and they need to be moved, and you need your hands free. So if you can figure out a sling or a carrier that you can put your baby in comfortably and safely, so that you can visualize their face and know that they're not all scrunched up in a ball and that they're getting a nice flow of oxygen and so on, but your hands are free, and that you can sit on the physio ball in front of your computer and check your email, or you can sit on the physio ball in front of the table and eat your chicken. It will be a win-win situation for everybody. And even though it gets tiring, and let's face it, even the best carrier with back support, after you wear your 12-pound baby for 2 hours, you're feeling it. But it's a short-term scenario, and it really does help. It really does make a difference. If your baby will sleep for 2 hours in the sling or carrier, but sleep for 20 minutes when you put them in the bassinet, there's nothing wrong with letting them nap safely in a sling or carrier. And then the super swaddle technique, which is a special arms down snug swaddle. And if you remind me at the end, I meant to put the link on here, but I didn't. And that's a swaddle method that I teach, and you need a special big, thin, stretchy blanket, but you don't need any special blanket to do it. It just needs to be a big, thin, stretchy blanket. Then, of course, there's all kinds of nice newer swaddle products that can do it for you, like a Miracle blanket or the Woombi, and so on. But the super swaddle is something I've been teaching for many, many, many years, and works like a charm. So here are some breastfeeding support products that can help your milk production and help your breastfeeding. And the reason I say that they can do these things when they have nothing to do with breastfeeding is because normal newborn behavior leads moms to doubt their ability to fully nourish their baby at the breast, because the normal newborn behavior of the infant is such that mom is sure something is wrong and the baby is still hungry. So things that calm and lull and soothe and help a baby relax or help a baby sleep are things that will help your breastfeeding, because it makes you feel a little bit more empowered that your baby is normal and I would say happy and healthy, but let's just focus on healthy, because again, between weeks 3 to 7 or 4 to 8, a lot of new babies are not particularly happy a lot of the time. So a continuous white noise machine, because white noise works well, snug swaddle with the arms down, learning how to sit on the physio ball and get a nice bounce going, particularly if you have a partner or a helper or a family member who can do some of that lulling for you to give you a break, that's good. Getting out of the house, because being home and being isolated does not help. And if you are terrified about leaving the house with your baby, you got to start getting practice on that, because feeling trapped at home with a crying baby who wants to nurse every hour is very, very stressful. And you might be very surprised that your baby is actually happier when you take your baby out of the house. So as long as you don't have to stop at a red light and you can keep that car going, your baby will probably sleep in the car for an hour or 2 hours if you're on the highway, if you're going somewhere far away to visit family. If you're in the stroller and you're in the mall or you're in a store, as long as you keep that stroller jiggling and moving, your baby may hopefully stay asleep. And then again, the slinging carrier that I mentioned earlier. Okay, so some other things that are important in the early days about milk production, milk supply, and relationships to early events. Jaundice is very common. More than 50% of babies will experience a little bit of breastfed babies, I should say, will experience a little bit of jaundice. And sometimes jaundice and low weight gain can go hand in hand. But jaundice is not always a pathological issue, and it can, however, make a baby sleepy, and a baby that's sleepy is not going to be nursing well. And the more colostrum, early milk and breast milk a baby takes in, usually the quicker their bilirubin levels will begin to improve, and the jaundice will resolve faster. But it can become a negative downward spiral if the baby is jaundiced, very sleepy, not feeding well, so they're not taking in a lot of milk. So both mom's milk production is not being fully stimulated, and the baby is not taking in a lot of milk, which will affect both their weight gain and their bilirubin levels. And I mentioned a late preterm infant because I think there's more awareness now that these 36, 37, and 38-week babies are not truly full-term, and they don't always act like full-term babies. They fool you the first day or two when they're a little bit more awake and alert and vigorous, and then they go home and they do nothing but sleep. And they do often become jaundiced and lose too much weight. And so that's why initiatives like the March of Dimes, 39 weeks, trying to reduce unnecessary elective inductions of birth and C-sections before 39 weeks is so beneficial, because these little 37 and 38-week babies that didn't necessarily decide to come by themselves sometimes do get very sleepy, very jaundiced, and don't feed well. Okay, low weight gain. So that's another thing I want to talk a little bit about. Low weight gain in the early days does not indicate a milk production or a milk supply issue initially. It can, but that's not always the reason that a baby isn't gaining weight well. It may result in decreased production, but that may not be the primary reason why the baby isn't gaining weight well. So again, we talked about the sleepy baby, the jaundiced baby. That baby is not going to transfer milk frequently and vigorously, and that's why the weight gain is low. It's not because mom is not initially making enough milk for the baby. But if the baby's not feeding well and mom is not doing something else to stimulate full milk production, over time that can have a negative impact on the amount of milk that her body learns to make. I'll get into some of these other issues in just a minute. Amount of supplementation I mentioned as well, because if there are latching issues or jaundice issues or other things going on, and the pediatrician or the hospital nurses got mom started giving half an ounce or an ounce of formula after breastfeeding sessions, and then more and more the baby is getting an ounce of formula after 4 feedings, after 6 feedings. If you have a 2-week-old baby who's getting 8 ounces of formula in a 24-hour period, that's 50% of the baby's daily intake right there, if not more. And if mom, again, is not pumping and not working to solve the breastfeeding issue and also fully stimulate full milk production, her body essentially thinks that it only needs to be making half the milk the baby needs, and that will result in low production over time. So perceived low supply, when you think that that you're not making enough milk, and that's why your baby is acting fussy at the breast and waking up frequently and wants to nurse so long and doesn't self-detach, and wants to hang out and feed all the time, which, as we discussed, is not easy, but can be very normal newborn behavior. Again, as long as the baby is peeing, pooping, and gaining weight, you can assume that the baby is getting milk and is getting the appropriate volume of milk if they're peeing, pooping, and gaining weight. But sometimes, particularly in the evening when moms are feeling tapped out and the baby is entering those fussy hours, someone gets the brilliant idea to give the baby a supplement, some milk in the bottle, which of course, even after breastfeeding, most babies will gobble down with enthusiasm sometimes. That just seems to seal the belief in the parent's mind that it's true, the baby was hungry because the baby just spent 45 minutes nursing, didn't settle, won't go to sleep, and then you offer bottle and they gobble down 2 ounces of milk in 5 minutes flat. That just proves that the baby is still hungry. Well, not necessarily. We all like to eat. Babies like to suck. If there's milk coming out, often that's an added bonus. And also in some bottle feeding positions and some flow rates, the baby really only has two choices, to chug or choke. And so sometimes babies will suck down an alarming volume of milk in a short amount of time. And if this continues, so that, at first it started out just like a one-time thing, and now it's most nights the baby is getting a bottle after breastfeeding, and then sometimes during the day the baby won't settle and take a nap, so you try a bottle, and then before you know it, again, as I said, the baby may be getting 4 ounces or 6 ounces or 8 ounces of supplement in a 24-hour period, which then begins to be a chunk of milk that your body doesn't know it needs to make. And that becomes a problem because then when the baby does come to the breast, he has to work harder and harder to get less and less milk. And when that's rapidly followed up by a bottle, which is much more immediate and easier flow of milk, very quickly the baby decides to either shut down and wait at the breast and wait for the bottle, or scream at the breast and wait for the bottle. And both of those things can be, as you understand, a downward spiral and pretty devastating for breastfeeding. So the flow rate of the bottle, which is what these two images are indicating, and giving increasing numbers of supplementation, whether it's formula or your friend's breast milk or whatever you might be giving, that's not milk that you're pumping earlier in the day and giving to the baby. That can, over time, have a negative impact on your production and can really put a wrench in your breastfeeding scenario. I will say, though, that some moms do get into a routine at 2 and 3 and 4 weeks where they're expressing milk in the morning when they feel fuller and putting that milk in the fridge, and then having partner or dad give that milk in the evening or during one of the nighttime wakings, so that mom can either take a little bit of a break, or if mom feels tapped out and exhausted in the evening and the baby is cluster feeding, if you express that extra 1 or 2 or 3 ounces of milk in the morning and give that milk to the baby in the evening, that's not necessarily going to have any negative effect on your milk production, because in roughly a 24-hour period, your body still is making the amount of milk that the baby needs. So really what we're trying to do is stay in sync, keep the body in sync with the baby's needs. Most causes of low production are starting off with inadequate milk removal. So the key to establishing, initiating, maintaining full milk production really is about frequent and thorough breast emptying. And as I say in numerous webinars, early and often, one way or another, if the baby, for whatever reason, is not able to come to breast and thoroughly suckle in the early days, thoroughly remove milk, later on, day 5, day 10, day 15, mom needs to be initiating and maintaining milk a different way. So if it's not the baby, it's got to be the pump. But one way or another, 8 is really the evidence-based magic number. That's why I use the 8 ball all the time. So 8 times in a 24-hour period, that's roughly every 2 to 3 hours during the day, every 3 to 4 hours at night, thorough and frequent milk removal. This is what's needed to initiate and then maintain full milk production. If the baby's coming to the breast 3 times a day and mom's not doing any extra pumping, over time her milk production is going to really take a downward spiral in the early days. And we'll talk about older babies later on, because a mom with a 10-month-old or a 2-year-old can put the baby to breast maybe once or twice a day and may be able to still maintain lactation for a long period of time, but not in these early newborn days. And another concept that we'll get into now is the emptier the breast, the more you're removing milk from the breast, the faster the breast works to make milk to replace it, and the fuller the breast, it slows down the whole production line. So milk making issues can be on the mother's side or the baby side. There can be a lot of reasons why milk is not being removed thoroughly or made, but the end result will be the same. So it doesn't matter if it's a mom issue or a baby issue in terms of removing the milk. If the milk is not being removed, the milk will not continue to be made. And a full breast slows down production. That's called down regulation, and that's a nerve and hormonal response. So in the breast tissue, you can see back deep in the breast tissue, there are lobes, and that's where the milk is made and essentially stored until it's released in a letdown, pushed out, and delivered to the baby. When those become swollen and full of milk, it sends a message to the brain that says, we're all full up here, and you can just slow down or you can just stop. And another good analogy I like is all of these boxes on the conveyor belt. Imagine all of these boxes are being dumped into a pile at the end of the conveyor belt. And after a while, the pile is so big full of these boxes that it jams up the works, and the conveyor belt eventually just kind of stops. There's nowhere else for them to go, so it kind of sends a message, to the person that's putting the boxes on the belt, just stop putting boxes on the belt. There's nowhere for them to go. We've got plenty here. So that's what happens when your breast sits around for long periods of time full of milk. Over time, that serves to decrease milk production. And the opposite is exactly true. So by eking out another drop and another drop and another drop of milk, it essentially tells the brain to tell the body to make more milk. So let's see, I'll use that cardboard box analogy again. If somebody on the other end is yanking the boxes off as fast as they can, and even scurrying along the side of the conveyor belt to pull the boxes off before they get to the end, the guy at the top of the line is going to see, like, oh, gee, I gotta put more boxes on this conveyor belt faster. So I got to move faster. We need more boxes here. So it's the same kind of thing. So when the baby nurses well at the breast, and then you sit down and pump for 5 minutes, and you're eking out another drop and another drop and another drop of milk, then it does send a hormonal message to the brain over time that more milk is being asked for than the breast has readily available, and please step up production. So I call that increasing the ask, and as I like to say, a lactating breast is never empty. There's always another drop and another drop. It's kind of like a leaky faucet. But unlike a leaky faucet, if you put a bowl under a leaky faucet, after half an hour or an hour, you're going to see what's collected underneath there. And that's kind of the milk that's in the breast that's made in between feedings. But unlike a leaky faucet, when you empty the bowl that's underneath there, a breast is going to start dripping faster. So a leaky faucet is just going to leak on its regular dripping routine. But a breast, when you empty that little bowl that's collected, it kind of tells the faucet to start dripping faster. So the emptier the breast, the faster the milk production. These are some baby issues that can lead to lower production. And I'll start at the upper left corner. That's a picture of a jaundice baby, yellowish cast to the face. And we talked about how jaundice can make the baby sleepy, and a sleepy baby is not going to come to the breast very often or very vigorously. Over on the right-hand corner, I have a picture that I'm trying to use to indicate a poor latch. That baby looks like he is just latched onto the nipple, not very deep, so that's a shallow latch that can also cause nipple damage and pain. But sucking alone on the nipple is not going to remove a lot of milk from the breast. Baby in the bottom right corner, a lot of people look at that and see a baby crying. I look at that and see a very significant tongue tie. So that baby's tongue is anchored to the bottom of the mouth with a little flap of skin. And you've probably heard the term tongue tie in relationship to breastfeeding. That can cause some significant breastfeeding challenges. There are also lip ties, which can cause also some breastfeeding challenges. Not all tongue ties and not all lip ties do create milk transfer issues or pain for moms, but some do. A baby who's premature or comes early, or any medical issue that keeps the baby either away from the breast or separated from mom, can interfere with milk production and milk transfer. and a baby who, as they get a little bit older, starts sleeping longer at night. If the baby is starting to go 6 or 8 or 10 hours at night, and mom is not expressing or adapting during the day, in some situations, depending on the age of the baby, that can cause milk production issues. In this situation, if we're thinking about young babies, during the first establishing and initiating and maintaining milk production during the first month or two, in this scenario, maybe it would be like a night nurse, or a partner who's going to bottle feed the baby formula at night so mom can sleep. So if the mom is feeding the baby from 7 to 10 p.m., 7 a.m. to 10 p.m. intermittently, and then not feeding the baby at all at night, and the baby is getting a couple of formula bottles at night, her body is not being stimulated to make what the baby needs, and it will be that scenario that I mentioned earlier. Over time, the baby will also likely begin to protest spending time at the breast because he has to work harder to get less milk, and the bottle has more milk that's easier to get. And then these are some mom issues that can lead to lower milk production. And early engorgement, I like my pumpkin women to indicate when the breasts are rock hard and difficult to get the baby latching. Many women do have some early overfullness or engorgement, and that resolves with ice and Motrin and frequent nursing and gentle massage and sometimes some pumping. But some women do have like pathologic, really, really severe engorgement, and sometimes that can cause some issues in terms of longer-term milk production. Sometimes a pacifier is used to hold the baby off between feedings, or a pacifier is used as a Band-Aid or a crutch when mom's nipples are so sore that she dreads the next feeding. And so the pacifier itself may not always be problematic, but it may be a symbol or a signal of other issues that are problematic. The picture down below could indicate either sore nipples or mastitis. And again, if your nipples are damaged, sore, cracked, and you're dreading that next feeding, you're going to put the baby to the breast as infrequently as you can get away with it, and you'll keep the baby at the breast for short periods of time. And so I do hope that if you do have a lot of nipple pain or damage, that you can find somebody locally to work with. Certainly, if you're in Boston, Dallas, Fort Worth, or Atlanta areas, all of our centers have board-certified lactation consultants and consult rooms right in them. But you can find hopefully somebody very skilled that's in your hometown. And then the clock and this lady down at the bottom I'm using to indicate if you were at work and pumping. So it's not going to work that decreases milk production. Again, it is the frequency of thorough milk removal. So if you're away from your baby for a total of about 10 hours, an 8.5-hour workday and some commuting time on either end, that's about 10 hours, you're probably going to need to pump 3 times during that time frame. And on occasion, you may be able to get away with pumping twice, but overall, if you want to be maintaining full milk production and pumping to bring home milk to your baby and so on, and if you routinely skip pumping sessions during the day, your body over time may begin to make less milk. And then sleeping, we talked a little bit earlier about going long periods of time at night, going 8 or 10 hours at night without nursing or pumping, for some women can begin to decrease milk production. These are some pink flag issues that I wanted to bring up, and these are some of these are primary milk production issues, and some are secondary. So they are kind of mixed in there, but they're all maternal mom-related clinical issues. So during pregnancy, we do like to see breast changes, and that's usually something hopefully your midwife or OB will ask you about. Certainly, if you have a lactation consult, that's something that is asked about in terms of your history. Usually, breast tenderness during the first trimester, breast growth during the second trimester. The areola become darker, the blue veins become more prominent, and then breast fullness during day 3, day 4, day 5, and so on. So having no breast changes at all during pregnancy is a little bit of a pink flag. Pink flags mean these are things that we want to pay closer attention to. It doesn't mean that this is automatically going to be a problem, or that if you have something on one of these lists that you will not be able to breastfeed or make milk. Not at all. It just means that maybe a little bit higher risk, or maybe a little bit something that we do want to keep a closer eye on. So an example would be a mom who had breast surgery, whether it was a breast biopsy, or she had breast implants, which usually is not much of an issue, or breast reduction, which sometimes can be a big issue. And sometimes breast reduction can be a medium issue. So a breast reduction surgery is definitely a pink flag for milk production. It just means that this is someone, a mom and a baby, that we want to keep a close eye on, offer good support, provide education and information and resources before the baby's born and after the baby's born, so that we can keep an eye and intervene as necessary to make sure that mom is making all the milk she can make and the baby is getting the milk and continuing to gain weight and thrive. So breast changes I talked about. There are some anatomic differences with breast tissue that we look at. Classic terms for what's called IGT, it would be, which is insufficient glandular tissue. It's not a great name, but basically during your own fetal development, when you yourself were developing inside your own mom, before you were even born, sometimes things happen, and some women just are actually lacking sufficient breast tissue. So the breasts may sometimes look kind of normal, and sometimes they look a little bit different, and they may not always be able to make all of the milk that a baby needs, despite your best efforts. And having breasts that have these appearances, again, don't automatically mean that you will have breastfeeding or breast milk production issues, but it does mean that this is somebody who we really should be working with closely. So some examples would be asymmetric breasts, two breasts that look very different, breasts that are what's called tubular, so kind of long, skinny, and don't have a lot of firm tissue